Okay. This says 1, right? 1 milliliter. Okay. So we'll just do the same thing we did the other day. Okay. So today we are going to give a shot in the vastus lataris, which is in the leg muscle. And here are our syringe and our different needles. We have 2 different needles, one to draw up and one to shoot with. We're going to draw up with the 18. 18 is before 22. We got an 18 and a 22. So you put on the 18 first because that's your biggest needle. But if you want to remember, you go 18 then 22. You're 18 before you're 22. We stay away from these squares here because it's sterile.
Okay.
So what we do is we open it up like a bag of chips. And it's lefty-loosey, righty-tighty. Put it in between your hands like that and then twist. Righty-tighty. You don't have to get it too tight, but just tight enough where it won't leak. That's your safety gauge. And we'll throw that away. Now, this flips down. This just makes sure you don't discard your needle without the gauge on or the safety thing on. You want to pull the top off from the top and then push it down. If you have to recap, scoop and push it down because you don't want that needle to go through your fingers. So pull it off from the top, and if you recap, push it down from the bottom. So, and then on here, this black plunger, you would go, if you want to measure, because it's a 1 ml or 1 cc, it's right here, then it's the top of the black of the plunger. Not the bottom, because the bottom it would be too less of a dose, so we would measure from the top. So she gets 1 ml, and the top of the black plunger is where we're going to measure from.
Okay.
See? Very good. So if you put you have to re-scoop it. You never want to touch your needle because that's what's going into the medicine jar or the patient. You always want to put alcohol on top of your medicine, and you keep this in a dark place. Do not refrigerate, just in a dark drawer. You'd measure 1 cc of air, and then you would put that air into the medicine, push in, and then take your needle below the medicine line and pull out. Never touching the needle. Now you can pull out past the 1 if you want to make sure you don't get any air bubbles. Tap it a little bit and then you push back in. If there's like a little tiny bubble, I see a little tiny bubble, it's not coming out, I'll tap it again. But just know it's not going in the vein. So if it's like that tiny of a bubble, it is not going to hurt. And we'll get it out and I'll show you how. So we got it, the top of the black line is at the 1, twist down, and then you've got it. 1 cc. Now, pull back a little bit of air because we want to not have any medicine in that needle, and then push up on the safety guard. So we're going to switch out needles, and we're going to go with the 22 gauge. So like I said, 18 before you're 22, so this is the 18, this is the 22. We're going to shoot with this needle because this one's really fat and thick. We don't want that one. Open it like a bag of chips. Righty-tighty, lefty-loosey. loosey-loosey, righty-tighty with the other one. Bam, we're done. Okay, pull back, and then we're going to push that back up to the 1 again to get all that air out and get the medicine into the needle. And we see the little medicine drop right there. So now we are ready to inject. And LaShantae's all ready. She knows how to check for placement. This right here is her vastus lataris, this muscle here. And how we do get placement is, you can see her arm is up at the bend, and her other arm needs to be at the end of the knee, like that. So we got 3 sections, 1, 2, 3 in the middle. We want to go right below this right here. So every time we're going to go this spot, and then the next week that leg. Okay? I don't know why I'm yelling, but
you're doing a great presentation.
Turn the volume down, I guess. So we got this 3rd section. So we will place the needle right here. And let me get an alcohol pad. If you press down on her skin, it will kind of desensitize those nerve endings, so the needle won't hurt when you go in.
Never hurts.
Okay. And, you know, you can wear gloves, but usually if you have a Band-Aid ready, then she can get her Band-Aid on herself. And I will get the shot ready. You always dart very fast because you want to go through those nerve endings faster than slow. So, and you can move your hand, and we placed it right here, and it's lateral to the knee. So 1, 2. Pull back, no blood, and when you press in, it's going to be hard to press in because it's a lot of resistance. It's a smaller needle. And then you pull out just as fast as you placed it. Clip. Band-Aid. Where'd we get ya? Can't even tell. We are so good. We'll just stick it there. If you start bleeding, we'll move it. So the next week, we'll go on this place, and like I said, it's 3 sections. 1 from the knee, 1 from the top of the hip, and it's right below that first section there.
All right.